Welcome to another episode of Holistic Health Habits, the podcast where we explore the latest trends and innovations in holistic health and wellness with a focus on nutrition. I'm your host, Surani Fernando, and today I'm delighted to welcome Dr. Allison Siebecker, the co-founder of SIBO Info. SIBO Info is a leading resource for information and treatment of small intestinal bacterial overgrowth, SIBO. Allison brings a wealth of knowledge and experience to our discussion today, so this should be a super insightful episode. Welcome to the show, Allison. It's great to have you on.
Thank you for having me. Happy to be here.
Great. So just to start us off, and before we get into the ins and outs of SIBO, can you tell us a little bit about your background and what led you to focus on this specific area of SIBO?
Well, I always figure that my story is similar to many others in that I had digestive problems my whole life, ever since I was 5, and couldn't figure it out. Basically, it fit what is considered to be IBS, irritable bowel syndrome, which is just a group of symptoms with nothing else. Right. Not much else to help you, not much else to diagnose it. And eventually I figured out that it was SIBO. That was really the issue, and got amazing benefit, honestly, just within 24 hours from applying some of the treatments. I started first with diet. And, amazing help. So that lit a fire under me to share it with others. I could see it was not well known about at the time. This was about 14 years ago. And I just began a campaign of awareness raising. And I had already been to naturopathic medical school. I'm a naturopathic physician. And no one there really knew anything about it, honestly. I mean, no one anywhere really knew. So then, but there were people, and I found them, and they're. So I will say one thing that's fascinating to me is there was sort of a dietary world that knew something about it, and then there were hardcore researchers. And the main thing I did in the beginning was to merge those two together, those two sort of disparate areas of knowledge. And I started a conference, a SIBO conference, where I would meld all that together. It's like, let's just bring all the knowledge together. And so that's basically my background. I've been focusing on SIBO for about 14 years now. And when I was in practice, I'm just an educator full time now. But when I was in practice, that's all I saw. Every day, every patient had SIBO. So that's just what I devoted myself to.
Okay. And then how did you actually find out it was SIBO? Did that take a lot of steps to get to that ultimate diagnosis?
Well, I was doing research and I came upon the term, and yes, in the beginning, it was like, well, how do you diagnose it? I did a Google search back then. It was crazy to think about this, but the test for SIBO, which is a breath test, and the main primary one we use is a lactulose breath test. We could talk more about that, but it was on like page 5 or 6 on your computer of a Google search. Like, who usually even goes past page 1, right? So you can see how obscure it was.
Right.
And I finally, I contacted them, got to know them, figured it all out, got the diagnosis, spoke with the researchers, merged all my information together. And I can tell you also the first treatment I did, the main treatments we do, diet is very helpful for symptoms, excellent supportive. But the main treatments we do, since this is a bacterial overgrowth, is we use antibacterials. And so I did that, and basically all my symptoms went away immediately. But problem is it didn't last, and that's a big issue for treating SIBO and knowing about SIBO. Is about 2/3 of cases are chronic. And just very briefly, the reason for that is because there are many chronic conditions that cause it, and so then it starts to be a little bit more complicated. Some people, about 1/3 of cases will just, that's it, they're better. But the rest need a little more help.
Okay. And just to dial us back, I guess, there might be some people here listening that are not exactly sure what SIBO is, where it comes from. You're able to share a little bit about, the basics of SIBO and how prevalent it is and what are the most common symptoms?
Absolutely. So it's thought from studies that about 70%, 60 to 70% of IBS is actually SIBO, caused by SIBO. You treat the SIBO goes away, the IBS goes away. We know in terms of prevalence that up to 20% of the population worldwide have IBS, which is huge. It's a vast, vast number. Everybody knows somebody with IBS pretty much.
Right.
especially if you're a practitioner. So, I mean, real statistics might be smaller than that, but so you imagine 20% of the population and 70% of them. That's the kind of prevalence of SIBO. So, just briefly what it is it's when there's too many of a particular type, actually, now we know, of bacteria overgrown in the small intestine. That shouldn't be like that. Of course, there are bacteria in the small intestine, but it should be a small amount, because otherwise they interfere with digestion and absorption of food. That's the primary thing that's occurring in the small intestine. In the large intestine, in comparison, we know we have a lot of bacteria. We have the healthy microbiome. Now, another fundamental thing with SIBO is we now have been able to sort it out into 3 and really almost 4 types. It's a very fundamental thing to know, so I'll just briefly mention that. There's the type is based on the gas that the bacteria or microorganism make. So there's hydrogen, methane, and hydrogen sulfide. It's a similar classification with IBS because these affect bowel movement patterns, and IBS is classified by bowel movement pattern. So the hydrogen type, that's in the small intestine, and it's associated with diarrhea. The methane type, we know that causes constipation. So that's associated with constipation. That overgrowth can be in the small or large intestine. And because of that, the name of that type of SIBO has changed because SIBO, the SI for small intestine, didn't technically fit. So now this is called intestinal methanogen overgrowth, or EMO. This is just a technicality. It's a nomenclature thing. I still say methane SIBO because I'm so used to that from so many years.
Right.
The third type is hydrogen sulfide gas. This is associated with diarrhea in studies. Clinically, we often see constipation. This is kind of a curveball one. And that can also overgrow in the small or large intestine. And then the fourth type is just when you have more than one gas, so a mixed. So that would be SIBO mixed. So that's a very fundamental thing to know. And the core reason why is because our treatments are actually based on gas type, because there's different bacteria or archaea or methanogens, or what are causing the methane type, that are overgrown in each type. And many people will be familiar with pharmaceutical antibiotics. They use different ones for different conditions. So, and it's basically based on the bug you're trying to target. So that's just a core piece of knowledge that you want to know, because you want to be able to tailor your treatments to the type of SIBO. So that's basically the prevalence, what it is. I didn't mention the symptoms, though. Let me mention that.
Yeah.
It's the symptoms of IBS. So that's abdominal bloating or distension, which is just a terrible symptom that bothers people. Pain, terrible. It could just be discomfort, but abdominal pain. This can be mild, or it can be so bad it keeps people awake at night. And then there's the bowel movement troubles. So constipation, diarrhea, or a mixture of the two. And then there can be other symptoms like acid reflux, nausea, a feeling of fullness in the stomach where it won't go down. There's also mental emotional symptoms. Anxiety is very common in SIBO. Depression also. Anxiety is more common. And brain fog. And then, as you can imagine, fatigue is very common.
Okay. And in terms of the common causes of SIBO, is it mainly diet, or are we still trying to figure out what's actually causing this overgrowth?
No, we know very well. And it's not diet. I'd say that's probably one of the biggest misconceptions. I can't imagine a way a person could give themselves SIBO from their diet. Mm-hmm. It's caused by diseases, sometimes medications, and I guess we could say external factors like surgeries or injuries, things like that. So the most common cause of SIBO that's been very well studied and shown and proven is actually food poisoning. So this is a disease or a condition, but it's an acute one. It comes and goes pretty quick. So this is also traveler's diarrhea or stomach flu. And the exact pathophysiology of how this causes SIBO has been fully figured out. And I would say that's probably not only the most common generally, but in my practice, what I saw was the most common. And it's very surprising to a lot of people to think about that, something like, a day or two of diarrhea or vomiting and diarrhea could very unfortunately lead to, lifelong IBS afterward, which is actually SIBO. Mm. But it helps explain how common it is, because food poisoning, traveler's diarrhea, stomach flu is extremely common, and many people have had it more than once. One thing to know here, though, is that it's bacterial food poisoning we're talking about. Viral food poisoning is the most common. It's actually only about 11% of cases of food poisoning that become IBS and SIBO. So that's the most common. I'd say coming right behind that are actual anatomical or structural problems in the small intestine. Probably the most common would be adhesions. These are scar bands that form in the abdomen from surgery. So any kind of abdominal surgery. Could be a sporting accident, a fall off a horse or a bike, a blow to the abdomen, like a car accident from a steering wheel, or just, something like that. Endometriosis, very, very common to cause SIBO. That causes adhesions. Inflammatory bowel disease causes the same. So then we come to the category of diseases. So diseases that can lead to SIBO would be things like IBD, inflammatory bowel disease, diabetes, extremely common, hypothyroid, extremely common, Ehlers-Danlos syndrome, which not many people know about, but is actually pretty common, especially in the IBS population. It's a disease where the connective tissue becomes lax and adhesions can form. And there are more, so when you start to think of all these things, you can see how come it's so common, that 70% of IBS. And then I didn't mention the drugs just very briefly. Opioids, of course, we know there's been an epidemic of that. Opioid painkillers can lead to SIBO. And a risk factor for SIBO is proton pump inhibitors, extremely common drug that is prescribed. They're not a primary cause, but they can stack up and predispose someone to be more likely to get it. So there's more. Honestly, that's a good smattering, but honestly, when I've compiled all the causes that I can find, it's 2 full slides, and it's about, 80 causes right now,
Right.
more
Yeah.
than I'm up to. So, and they're all very, very well studied.
Right. Yeah. This definitely seems very multi-layered and like secondary to a lot of things. So like finding the root cause
That's
would be quite difficult. And is there any particular patient profile that shows up with this? Are there any particular people or specific ages, genders that might be predisposed to getting this if they have, one of those things that you mentioned?
Generally, in studies when we look at like IBS, which obviously the majority is SIBO, females are more at risk. They're more common to have it. And there are a lot of reasons suspected for that, but that could be because of hormones. We know that progesterone in particular can slow small intestine motility a little bit. That's actually the main way physiologically in the body that all of these diseases and drugs and everything can cause SIBO, is they slow the migrating motor complex, which is a form of motility in the small intestine. Or we can have the structural things where you get like an obstruction. But so females and ages, middle age to older, studies have shown older people are more at risk. But I can tell you that in my clinic, I saw, from 3-year-olds to 75-year-olds, and men and women. Of course, we have to remember that there's a higher likelihood of females to go to the doctor for help than males. So we do tend to see more females. It doesn't mean males aren't suffering as well.
Right. And you mentioned that, a lot of people who have SIBO would just have IBS and would be living with IBS. So how do you go from that IBS, awareness to then go and get checked to see if you have SIBO and get diagnosed with SIBO?
Yeah, one would hope that your practitioner, and of course all these wonderful people listening will be now these people, will be educated on SIBO and know what the test is. So the test is, as I mentioned, a breath test. We have 3 substrates, basically, that you can use for this test: glucose, lactulose, and fructose. The 2 key ones are glucose and fructose. I'm sorry, I said that wrong. Glucose and lactulose. And lactulose is what I highly recommend that we use. And the reason why is because glucose absorbs very quickly in the small intestine, high up and within about 2 feet. And then it's not available through the rest of the small intestine to test it. So what we're doing here is we're giving a carbohydrate substrate down into the small intestine, and then the bacteria, or methanogen in the case of the methane sebum, will consume it, and then they turn it into gas. And it's those gases we're trying to measure excreted out of the breath to let us know indirectly whether those bacteria are there, because bacteria make hydrogen and methane, humans don't, or methanogens make methane. And then humans do make hydrogen sulfide, bacteria do as well. And in that case, we're just looking for the excess amount. So this is how the test works. It's a sort of an indirect measure of how many bacteria are there creating all these gases. So the problem with glucose is that using that as a substrate is we can really miss a lot of cases. And clinically, we really don't want to do that. We want to be sure we're helping the people, diagnosing them if it's really there. So I strongly recommend lactulose. Now, this can be a problem because in the US, at least, lactulose is a prescription substance. It shouldn't be. It's a mistake. Honestly, it's used as a laxative, but that can limit access. You have to have prescribing rights to get it. Luckily, there are some lab companies that you can get a lactulose breath test no matter who you are, direct to consumer or whatever your degree is, whether you're a patient or practitioner. And those would be like Direct Labs, True Health Labs. Genova is the main test that is going through those. Rupa Labs also offers it. Another option, just this is practical information, is you can always have your patient get a glucose test, but then don't use the glucose. And for anyone who isn't a prescriber, ask the patient to go to one of their prescribing doctors, like their primary care physician, and just ask for some lactulose. It's pretty easy to get that from most primary care doctors because it's nothing harmful. It shouldn't even be a prescription. It's used for pets. You could even ask for it for your pet for, constipation. It's used as a laxative. So that's a good way to handle it. So that's the test. It's very important to know how to interpret the test. And one other key thing is it's very important, I think, to do a 3-hour test because the first 2 hours represent the small intestine. The third hour represents the large intestine. And remember, with methane and hydrogen sulfide, we have to see that third hour. And so one final thing I have to say is the standard test that we all have been using for years doesn't test hydrogen sulfide. That's a new advancement. It had to be created to figured out how to test that gas. And that's come out about 2.5, 3 years ago. And there's only one test that I know of that tests that, and that's called TrioSmart by Gemelli Labs. And same situation there with glucose and lactulose, Yeah. So if you want to actually test the hydrogen sulfide, you need that test. If you're using the traditional test, there's a sort of a way we get a sense if somebody had hydrogen sulfide, and that's with a 3-hour test. If there's no rise of hydrogen in the third hour, no rise of methane, almost no gas in the third hour, we suspect hydrogen sulfide. Obviously, this is just a brief little primer. This is why I say it's important to understand how to interpret the test correctly.
Yeah, definitely. And, are you finding that the education and awareness around SIBO and, diagnosing it has evolved rapidly over time? And is it still a little bit blurry in mainstream, health practices?
Well, what I could say is that our diagnostic methods are the same as they have been. The interpretation's the same. It's really, the whole time I've been in it, it's except for the advancement of now testing hydrogen sulfide. It's really just a matter of trying to get that information to practitioners. Because this hasn't been very known about, it's not embedded curriculum in most medical schools, no matter what medical school you're in. I did create a curriculum and have been teaching it in medical school that I teach at, but that's one school, for 13 years. And so that means it has to be postgraduate that people are going to have to learn about it. So that's really the problem. It hasn't changed. It's just trying to get the information to people. And, we have to take the burden upon ourselves now that we're out in practice to learn about this, which is unfortunate.
Yeah. And let's talk about treatments, because you mentioned that, the misconception is that diet is causing this, but you also mentioned that one of the first steps to heal your SIBO is diet. Can you talk a little bit about, different sort of treatment steps that you can use from the natural sort of practices in daily life to medication?
Absolutely. Diet is honestly one of the best tools that patients can have at home to help themselves feel better. So the key thing is that it helps symptoms. It's a symptomatic relieving treatment. And it becomes very important for those with chronic SIBO who have a chronic underlying cause that there's no known way to get rid of at this time, because then they can use diet ongoing to manage their symptoms along with other things we do to really live kind of a symptom-free life. That's the really good news here with SIBO, despite the bad news being that for many people it's chronic. It doesn't mean you have the bad symptoms continuing. We typically see people get to 90% symptom relief. That's like standard. actually, which is incredible, often 100%. And diet's a key part of that. You can bring diet in along the whole treatment journey wherever it suits you and the patient. So let me just briefly describe sort of a treatment algorithm for you. And this is based off, so Dr. Pimentel is our lead researcher in SIBO. He works out of Cedars-Sinai in Los Angeles. And he published a treatment algorithm back in 2006, believe it or not. And who knows about this? Not many people, right? Yeah. So then my team, we created a SIBO center. And as I mentioned, we saw only SIBO patients. We made some adaptations to that algorithm. So basically, first thing is test, find out if it's SIBO. If it is, then you can bring diet in anywhere along the way, but I would recommend waiting till after you test, just so you can get the most accurate picture with the test. Then you want to use antibacterials to bring that overgrowth down. Now, the question always comes up, could you just use diet? Yes, if the patient is getting satisfactory symptom relief and you as the practitioner are satisfied with the quality of their diet, the making sure they're not too limited. Because sometimes to get that really good symptom relief, people are down to 5 foods. And that is where we want to come in with antibacterials to get the overgrowth down, because the diet doesn't actually get the overgrowth down. So we can then expand the diet, right? So, we work with what we need to in front of us. So for antibacterials, we have 3 main options: pharmaceutical antibiotics, herbal antibiotics, and elemental diet, which is like a medical food beverage. So for pharmaceutical antibiotics, I'll just briefly, describe everything here. The main one is rifaximin, sold as Xifaxan in the US. And this treats hydrogen, but we use it for all 3 types of SIBO. When someone has methane, we add to it metronidazole, which is sold as Flagyl, or neomycin, because we have to target the methanogens, they're not actually bacteria, with a different item. So it's a double antibiotic therapy there. And then when there's hydrogen sulfide, we add either bismuth, high-dose oregano to the rifaximin, or nitazoxanide, which is sold as Alinea. Now, the herbal antibiotics, just wanted everyone to know what those are.
Yeah.
Herbal antibiotics, my group has done a lot of experimenting with dose finding and with before and after testing to really figure out what herbs help each type of SIBO. And so just basics here is that oregano, berberine, and neem are used for hydrogen. They're good for hydrogen. When we have the methane, we add allicin, and the one that we like to use is Alimed or Alimax Pro, sold as both, or Atrantil. That targets the methanogen. So again, it's double antibiotic therapy, herbal antibiotic therapy, because you choose one of those hydrogens and one for the methane. And then for hydrogen sulfide, you could use bismuth, high-dose oregano, alone or together, or that's it, because otherwise we get into the pharmaceuticals.
Yeah.
Then for the elemental diet, there's now a whole lot of wonderful commercial brands that are more naturally oriented, available through, Fullscript and, not prescription. And we use that. And what the premise of that is, people are not eating anything else. They're just drinking that, and they wind up starving the bacteria because that substance easily absorbs into the body, feeding the person, but does not feed the bacteria. And so it's a different mode of killing. So we would consider that natural, because it's a very natural approach, really, and the herbal antibiotics to be natural. Those don't need prescriptions, and they're very effective. One key thing to know is that pharmaceutical and antibiotics and elemental diet are done for 2 weeks as one treatment round. Whereas herbal antibiotics, it's 4 weeks for one treatment round, meaning it just takes longer to get the same effect when you're using the herbs, but they are all equally effective.
Right. And just talking about the pharmaceutical side of it, because, just generally when we talk about antibiotics, we talk about, that also impacting the gut microbiome. So how does that work with, using that to solve the problem, like a microbiome problem?
I'm so glad you brought it up because rifaximin is extremely special, and it's considered a eubiotic by many. Some don't even want to consider it an antibiotic, although it is, because it has incredibly beneficial properties. It's the most unique antibiotic you'll ever find. not only does it not harm the microbiome, it actually helps it. And we have study after study of this. It increases Lactobacillus bifidus, Fecalibacterium, and several others. I can't remember them all. Mm-hmm. So it's actually phenomenal. Dr. Pimentel has done studies with rifaximin. So he's done deep sequencing of the small intestine with culturing. He's actually, that's the most advanced. You know how the microbiome has been mapped? That was just the large intestine. He is mapping the small intestine microbiome. Anyway, point being, he's done before and after testing with, normals and SIBO patients. And just with rifaximin, only that brings the microbiome completely back to normal. So no harm and only help. Now, when you start adding in metronidazole, neomycin, or linea, then you will have some harmful effects on the microbiome. And if you're using pharmaceuticals and you have methane, you must bring those in. So then, yes, you can add in probiotics to help mitigate that damage.
Okay. And you did mention that I believe the elemental route of treatment route is a form of starving the bacteria. Is fasting a tool that can be used in conjunction with all of the treatment methods?
Absolutely. And it's so great you thought about that, because honestly, I think it's one of the first things a lot of us think, well, hey, why can't we just water fast, meaning all you're taking is water? Mm-hmm. One problem is that what studies have shown is you need about 10 days of starving the bacteria for there to be an effective treatment. So we're talking a 10-day water fast at minimum, if not even 14-day. That's arduous.
Yeah.
That takes fortitude. People do it, but that's not the common thing we're going to be asking our patients to do. Whereas this, they're getting proper calories, proper nutrition. In fact, many patients with SIBO are underweight because this is a malabsorption condition. The bacteria are consuming the host's food. So people who are underweight actually very often, so long as they consume the full calories that are recommended on elemental diet, will actually gain weight because they're actually absorbing the nutrition. Mm-hmm. So very beneficial in that way.
Okay. And just going back to the food poisoning, because, you mentioned, different causes that lead to SIBO. And I think thinking about myself in particular, like as a generally healthy person, I'm not on any medications. I don't have any, diseases, but I travel and I could be, a victim of food poisoning. Are there any particular bacteria, that coming into the food that people should be a little bit more conscious about with it leading to something like SIBO?
Yes, the exact bacteria are known. It's Campylobacter jejuni, Salmonella, and E. coli.
Okay.
But how do we know that that's in our food, right?
Right.
So, and while traveling seems to be more likely to get it, honestly, people get food poisoning going out to restaurants in the U.S. or wherever. So if you're concerned about it, what's recommended is to take either an herbal antibiotic or a pharmaceutical antibiotic, like one pill with meals. Many people will use Alimed or Alimax Pro for that, just take one with meals. Another thing you can do is use serum bovine immunoglobulin. That's been shown in studies to prevent food poisoning. And I know several cases of that working. Mm-hmm. So that's kind of expensive. Then again, so is Alimed, Alimax Pro, You could use oregano, you could use something else, but something that would be preventative. Certainly a good idea when traveling.
Okay. And I think about myself, when we're having this discussion, I'm sort of the person that does the sniff test with food when, it's in the fridge, it's been there for a few days, smell it, is it okay? Maybe someone else might be like, no, I'm not taking any chances, but sometimes I'll go there. And so now I'm thinking, like this could not just be, sometimes I'm like, oh, okay, well, if I have a little bit of something the next day, that's fine. I don't have to go be anywhere important. But now this is putting a different light on it with a chronic condition.
Well, I'll tell you what is so interesting. Very often people who've had food poisoning are the very ones that are less strict about it. And I almost think it's, how people sometimes think if you have yeast overgrowth, I think many of us think this, it makes you crave sugar, So it's like those of us who've had food poisoning, we'll do the sniff test and be like, yeah, it's fine. We'll take much more risk than other people. They're like, I'm not going to risk getting food poisoning.
Yeah.
So definitely if you're at all concerned, don't do it. It's not worth it. Good Lord, it's not worth it.
Right. Exactly. So tell me a little bit about SIBO Info. So you mentioned that you're not practicing anymore. You're more like the information provider. What does SIBO Info do?
Yeah, SIBO Info is just a free educational website that I created way back when to try and get the information to people. Honestly, when I first started, like I said, you had to go to page 5 of a Google search and there was nothing. So I just was like, oh my gosh, all of us need something. So it's just free educational website with lots of information. I've got labs, testing labs listed internationally. It's a resource for you and your patients. I also have training courses on test interpretation. I've got a mini training course if somebody wants to get in, get out quick. And then I've got full comprehensive with CME that's like 22 hours, teach you everything. I also do a lot of, I give free Q&As. I do master classes that you can all access through there. Good idea to just sign up for my newsletter. Also, if you want to stay up to date on research, every year in the spring, there's a ton of new research in SIBO that comes out because, as you mentioned, it's still an evolving field. And I do a big update, in my quarterly newsletter in the spring, or I guess you could say in the summer, because that's when all the information. So that's what I'd recommend if you want to stay up to date on all this.
Yeah. Okay, great. And I'm sure you have so many case studies that you've gone through throughout your career, but just for our listeners to get a little bit of tangibility, is there something you can share, like maybe a patient, and their journey from having the symptoms, getting diagnosed, and then being on the road to a cure or recovery?
You mentioned you were going to ask me this at the beginning, and what I was thinking is it's actually hard to think of single people because we just have so many cases like this. This is the good news, is knowing how to treat SIBO well and treating it makes a huge impact. It's the rare person that does not improve dramatically. So, I guess we could use myself as an example. I had symptoms that would keep me up at night with terrible pain and awful food intolerances. I was suffering so bad. And I did the diet, I did pharmaceuticals, I've done herbals. I have chronic SIBO, still looking for my underlying cause, although I have some suspicions. And, I work full time. I'm happy. I don't suffer from symptoms. I'm free of symptoms, for the most part. Everything's really managed. I've got a friend who's a doctor, an MD. Her underlying cause was Lyme, and she was suffering maybe even worse than I had been. Terrible, terrible food intolerances. She was emotionally terribly impacted. She could hardly eat anything. This is so common. We treated her SIBO, and that managed things. Then we found the underlying cause was Lyme. She went and got treatment for that. That can be long and complicated, but she did it. She's free of Lyme and she's free of SIBO. She doesn't have to think about anything she eats. It's incredible. She's all better. So this, anyone who treats SIBO, you see this. It's just, you get in there, get that bacteria down. And one other thing I didn't mention that just must be mentioned is because so many people are chronic, you must have a plan in place for managing relapses if they occur. And the main thing we do is we put people on a prokinetic as soon as they finish their antibacterial treatment. This is something that helps stimulate the migrating motor complex. And there are a lot of natural herbal options. I call them the ginger-containing prokinetic formulas, things like MotilPro, Motility Activator. There's a smattering of them. And Iberogast and similar products to Iberogast. There are pharmaceuticals as well, but I couldn't end this without making sure, because this is a huge missing component in people's treatment. You don't just work on the bacterial level. You must do something to help hold what you've done.
Yeah. Okay. Really good tips there. And, just for some of the health practitioners out there that might be, struggling to navigate these patients and getting them onto the road to recovery, what would be the major challenges that you would say to focus on and, overcome the challenges that you see as the major challenges?
Well, for many people, the main challenge is testing, just making sure you're able to have your patients do a lactulose breath test and I didn't mention this, but the majority of patients will need more than one treatment round. This isn't an acute infection. It's an overgrowth. We treat till we get effects. So that's a key thing to understand. You're not doing anything wrong and you haven't failed if it wasn't cleared in one treatment round. Most people need 3 or 4 treatment rounds. So we also advise testing between treatment rounds if a patient can afford it in their budget, because this really guides your next treatment, and make sure it really is still there, because sometimes it's gone, but they still have symptoms from something else. People have more than one thing wrong with them. So I would say making sure you're testing. The biggest point of failure and making a case tough to treat is guessing, right? So you want to know what you're doing. So test with a 3-hour lactulose breath test, diagnose it. Now, putting that aside, that you're going to test, you're going to do multiple treatment rounds, and we often switch up what we're doing round to round. If you're doing all that, you know all these treatments I've said, you're doing all that, and they are not improving, the number one thing we think about is mold illness. Mold illness is, probably an epidemic, mm-hmm. and it makes it that you cannot progress forward in what you're doing to treat SIBO, and we find it must be treated first. And it's a whole specialty unto itself. You don't need to have that as your specialty. You can refer. There's excellent other people doing it, or do it yourself. But that is probably practically something very important to look at. And also MCAS or histamine intolerance, if you're really having trouble treating SIBO, because that makes it so that people can't tolerate the treatments that we give. As you know, people with histamine intolerance and MCAS can hardly handle anything, any supplement, right? They just react to everything. So you've got to get that under control so you can then give the treatments.
Okay. Yeah, that mold thing is something that I'm hearing about like more and more. And it's just kind of, that sabotage to lots of, routes to finding a treatment to whatever other disease that you might think you might have. So yeah, I think I become a little bit more conscious of if there's damp around or if it's been raining or, mold around the place, just because I'm hearing a lot more about them. But that's definitely a good tip for our listeners. And just finally, just for, the general people listening out there that are just, curious about this area, what practical tips can you offer, for people looking to improve their gut health and potentially prevent conditions like SIBO?
Generally, improving gut health is, of course, not eating processed foods. It's going to be all your basics, and making sure you're eating fermented foods and or taking probiotics. Healthy lifestyles, getting enough sleep, drinking enough water. We call them the basics, but they're so not basic. They're so powerful, right?
Yeah.
All of these wonderful, healthy habits. For preventing SIBO, this is a hard one because there are so many causes. So it's like, well, how do you prevent diabetes? Well, you don't eat a ton of sugar. You have a healthy lifestyle. How do you prevent food poisoning? Well, we talked a little bit about that. Maybe take an herbal antibiotic if you're traveling with your meals. How do you prevent hypothyroid? I don't know. How do you prevent Ehlers-Danlos? That's genetic. Okay, so it depends on the disease. When we get to medicines, if you need to take an opioid for, you're having a surgery or something and you're going to need it, or a proton pump inhibitor, take a prokinetic with it. Particularly opioids, you can get those in a form compounded or in a form that does not cause constipation. Ask the doctor for that. And if you have to take a PPI, take it with a prokinetic, or better yet, take an H2 blocker, a less strong PPI. So, anything you can do to protect the normal digestive mechanisms. We want hydrochloric acid secretion. We need that movement in the small intestine. Don't slow it down. Things like that.
Okay, great. Well, these have been amazing tips. Thank you so much, Allison, for joining the podcast and sharing all of your insight. This has been, quite a new area for me. So I definitely have learned a lot and have a lot of food for thought to take forward. And I'm sure our listeners have gained a lot from this discussion as well. So for those who want to learn more about Allison and SIBO Info, which she mentioned that she's got some courses, be sure to visit the website at www.siboinfo.com. And do you have anything else to mention on that, Allison, in terms of what you're offering, in terms of the main thing is
good enough.
Yeah. And for everyone listening, don't forget to subscribe to Holistic Health Habits for more episodes featuring top experts in the field. Until next time, I'm Surani Fernando. Take care and stay healthy.